Thanks, Catherine. In this next segment, we're going to look at the area of accountability and continuous improvement. And in line with the rest of this event, this has been developed in collaboration with the members of the Kilkenny Mental Health Forum as part of co-production. But I suppose with a new ambitious policy, and this is a really exciting time, but I suppose we need to be careful how do we know this happens and how do we know that there's accountability for its full delivery. So across sharing the vision, it's set out in a number of areas, and you've heard already in relation to promotion of positive mental health and early intervention, service access, social inclusion. And this focuses on the business end in terms of the accountability and continuous improvement. And in the document, it's set out very clearly in the back section around the who, the what, and the where. So what are the tasks that will activate recommendations? Who are the lead agency? Who's responsible? What are the outcome indicators? And equally, when will this happen? Is this a short-term goal, a medium-term goal? And this is really important if we're going to get full delivery across the lifetime of this program. Harry Truman, the great American president, had a little sign on his desk and it basically said, "The buck stops here." And I'm not sure his successor has necessarily followed this, but sometimes the buck stops with everyone. And while this is an embrace of an inclusive approach, we also need to be a little bit careful of this. I suppose most people are familiar with the old adage, and it's a fairly familiar story, about four people named everybody, somebody, anybody, and nobody. And there was essentially an important job to be done, and everybody was sure somebody would do it. Anyone could do it, but nobody did it. Someone got angry because it was everyone's job, and everyone thought anyone could do it, but nobody realized that everybody wouldn't do it. It ended up that everyone blamed somebody when nobody did what anyone could do. And just to draw your attention to the title of the document here, you can see in terms of sharing a vision for everybody. So is it sharing a vision for anybody or for somebody, or is it for nobody? And I think it's really important in this distributed co-production approach that we're very clear of who's taking on what tasks and how that operates, and equally how to report on that. So this domain is broken out into 4 areas, and they're listed 4A, B, C, and D. We're going to hear from our colleagues in a few moments in terms of what does this mean? If we're going to make it real, make it happen, what do these messages really stand up to be? For example, what does it mean to be integrated? You know, that mental health is fully embedded as a national cross-cutting priority and effectively integrated into key policies and settings across society, not just within the domain of the health service, but at broader government department and indeed NGOs like our organisation, our role and responsibility here. Also in terms of 4B, dynamic performance reporting. So this is where there's an accessible signage and a clear statement that says we're making progress, we've hit delays, and this needs to be in an accessible format that's developed with service users, family members, providers, and professionals working together so we have valid indicators to illustrate the success and progress of this policy. As with its predecessor, our whole approach here has to be person-centric. And this is where services are delivered that are of a high quality, they're person-centered, and that they meet the needs and have the confidence of service users and family members. And that's absolutely critical in all aspects of the program. And finally, that it's future-focused. It's not static. It sets out key principles and objectives, and it doesn't set particular goals that are fixed in time. So there's also space for innovation, and that innovation is adequately resourced so that not just the health service, but all the related sectors can work together to fully realize sharing the vision. Sometimes when it comes to blame setting, notice when you're pointing a finger at someone else, you're pointing 3 fingers back at yourself. So it's really important that we know where we're starting from, we know where we're getting to, and we're very clear and have declared targets to work together. It's a 10-year program, and sometimes it's hard to conceptualize time. So maybe just to remind you, where were we this day 10 years ago? And I suppose we were actually celebrating because the first of the Chilean miners was rescued from an underground collapse. So that's what 10 years feels like. And just think of all of the events and life events and movement that's happened in those 10 years. Now project forward and you can see what 10 years into the future might feel like. So let's now hear from our co-collaborators on this presentation from the Mental Health Forum in Kilkenny.
Hello, my name is Millie and I'm from the Kilkenny Local Mental Health Forum. Today I'm going to comment on the outcome of 4A in sharing the vision. Mental health is embedded in a national cross-cutting priority that is effectively integrated into key policies and settings in society. Now, to me, that's a very convoluted sentence. What it means is that mental health is everybody's business, not just the Department of Health. For a functioning, healthy society, mental health policies have to be cross-government departments. For instance, housing, education, justice. Also, the statutory and voluntary bodies that have care of people. I have a good example of this actually here in Kilkenny with the Housing First policy. The HSE, through the SRF funding, worked with Focus Ireland, the Good Shepherd Centre and the local authority to provide houses for vulnerable people. I know about this because my son is a recipient of one of those homes, and it took a huge burden off of us as a family when we were unable to help him any further.
Hi, my name is Colin MacDonald. I'm the chairperson for the Kilkenny Mental Health Forum, and I'm here today to discuss outcome 4B of the sharing division. Dynamic performance reporting provides visibility of the performance and the impact of sharing division. To me, that means that we need to put into place monitoring system to monitor the implementation that is going to be put in place for the new changes in sharing division into our local areas, and set up like a panel to monitor the process throughout the year and to report back not just to the local groups, but to make sure that the local groups report it to individuals that are involved and that need the services which are being provided. So I think it will be very important to make sure that there is a person from each organisation involved in the monitoring of this process throughout the year, and to do up an end of year report and publish maybe along those lines. I'd like to thank you all for listening, and hope you have a good webinar, and thank you very much. Any questions can be answered at the end. Thank you.
Hello, Gina Delaney here, and I'm a member of the Kilkenny Local Forum, and I'm talking about outcome 4C, and that is services that deliver consistently high quality person-centred supports and that have the needs and the confidence of service users and family members, carers and supporters. So what that means to me is that we have needs-based services and human rights-based also. So and in order to achieve that, we need to make sure that all our services that we are developing and delivering and evaluating are done with the people who access the services and family members, so that everything we do is done through co-production. And examples of how this can be put into practice, if we think about the framework for recovery, and we have actions, for example, around family recovery, and what that means to me then as an individual and for my family is that we have services that are really meaningful, that will make an impact, such as family peer support, somebody that you can sit down with and talk to and share your worries and your concerns with, and that will have an understanding because they will have been through a similar situation, and they will be able to then point you in the direction of other supports and services that could help you, and that then will have a good impact on the rest of your family and will support family recovery.
Hi, my name is Michael Brennan and I'm a member of the Kilkenny Mental Health Forum. I was asked to say a few words on outcome 4D, which is that continuous improvement will be future focused and driven by adequately resourced innovation across the mental health system and related sectors. Now, the way I'd see that, if it was to be actually realised, would be that mental health forums like our own would be actively supported, promoted, and that dialogue between ourselves and similar forums would be encouraged and facilitated. It's only through dialogue and talking with one another across all of the sectors that these outcomes can be generated and that we share ideas. All the best to all in the forum and on the webinar.
So we're very keen, when it comes to sharing the vision, that we keep it real. And we also want to know very clearly, and we're interested in your viewpoint, in terms of how will we know that we've achieved that. Thank you.